Hi everyone, Matt Padarini here with the Nontraditional Pharmacist, joined today by Samm Anderegg. Am I pronouncing that right, Sam? How do you pronounce your last name?
Yep, you got it, Anderegg.
Okay, cool. Sam's the CEO of DocStation. Wait till you guys hear about DocStation. It sounds super cool to me. Basically, what it is a patient care platform that for healthcare teams, enabling pharmacists and other clinicians to provide value-based care. So we're excited to hear more about that and Sam's path through non-traditional pharmacy. And so welcome, Sam. Appreciate you joining.
Absolutely. Thanks for having me.
No problem at all. So let's start there. If you could, just describe your path through pharmacy, where you are today, and kind of how you got there.
Yeah, no problem. So grew up in small town Iowa and went to the University of Iowa for, undergrad. Spent a couple of years trying to decide what I wanted to do, and pharmacy seemed like an interesting route. I had a family member who was graduating at the time, and just debating between the different sciences. And pharmacy seemed interesting to me because it was so. I felt like there was a lot to gain, a lot for the profession to grow, which interested me, and kind of wanted to be a part of that. And so got into pharmacy school, and then immediately started asking questions like, how do I position myself to be kind of a patient care provider after I graduate, and had a lot of really great mentors recommend, look into residencies, but make sure you get a wide variety of experiences. And so I really took that to heart and made sure I got involved in things like research in school, doing things like leadership positions in organizations, and just was really empowered by some of the work that we were doing and all of the great, mentorship and advice I got. And so decided to do a residency that kind of fit all of my interests, which was administration. So I did a first and second year residency at University of Kansas Hospital with a master's, and learned just a ton during those 2 years. How to be a clinician, how to practice, how the healthcare system really works on an operational level. And then learned about all the different facets of leadership from the management team. So clinical operations, IT, inpatient, outpatient, reimbursement. And so learned a ton, really enjoyed that, and decided to get an entry-level management position. I want to get out of the Midwest and have some more diverse experiences. And so I went down to Georgia and managed ambulatory care oncology, and started some specialty pharmacy, bedside delivery, and again, just kind of cultivating those interests, but not necessarily specializing in any one area. And throughout that time, actually since I was in school, I got involved with the Pharmacy HIT Collaborative, and they were just starting when I was doing my rotation at ASHP, and just volunteered to do some work and stayed with it, and eventually made it into a little bit of a contract job, so got paid for it. And learned a ton and realized that was really where my true interest lied. It took me a while to get there, but finally figured it out. And about 2.5 years into my job and down in Georgia, I decided I kind of wanted to take a little bit of a career path change, and went all in to the IT side of things, the tech side of things, and had an idea in my head for a while to build a software system that actually works like it should in healthcare, and that's how DocStation came about.
Nice, very cool. So you went through residency, and all of those diverse experiences kind of led to you finding out where your real interests lie, which is in health information technology, IT, informatics, that sort of thing, developing software. It's super cool to me. I'm in informatics and the IT world myself now, so it's particularly interesting to me. But it sounds like the experiences that you had in residency led you to that, and you wouldn't have necessarily gotten there had you not done a residency. Is that true?
Yeah, I would agree with that completely. When I was graduating from school, I had a lot of ideas in my head of what I wanted to do, but I didn't really know what the real world was like and how to practice as a provider. So I learned a ton in residency, exposed me to a lot of different opportunities, a lot of possibilities. It really gave me the confidence that I needed to really go after anything. And I think that's a lot of what led me to, making the leap and doing this whole entrepreneurship thing. So I'm really glad that I did it.
Yeah. So you would recommend residency to everyone, or not necessarily?
Well, I think it depends on each individual person. Everyone has their own circumstances. Some people want to get out and practice and start working right away. And if you find an opportunity that fits you, there's nothing wrong with that. But if you're still kind of trying to figure stuff out and you want to make yourself the best possible candidate for the job market, not only now, but into the future, I think it's definitely something to consider. And I encourage it to the people who are interested, and it's a good fit for them.
Okay, great. So DocStation, let's talk about DocStation. What is it? What is it all about?
So DocStation is basically, think about it as an electronic health record specifically for pharmacists. So throughout the experiences that I had in practice and research and a lot of different areas, all the tools that we use to provide care to patients served the purpose, but didn't necessarily work exactly how they should work, especially when you're exposed to all the new technologies of today. And there's just countless times over and over again where, we wanted to implement a new program, or we wanted to change the way that we practice in some way to provide the best possible care to patients and get the best outcomes and reduce cost. And most times, we were prevented in some way, shape, or form by the information systems that we were working with, whether they didn't collect the right data, or they didn't fit into our workflow, or we didn't have the appropriate resources to make the changes we needed to our current systems. It was just really frustrating. And I felt like, the biggest impact that I could really make as a pharmacist was to take that experience from practice, use my background and skills as, in technology to kind of blend the two together and do something great for patients and do something great for our providers. So that's really what fueled my passion to get into this. Yeah.
Okay. How did it start? Walk me through how the idea came to mind, and then obviously, I've no doubt it was a tough process to make the decision to go all in and pursue this path. Walk us through that story.
Yeah, absolutely. I'd love to. I think so. My first 2.5 years for a real job in Georgia as a manager. Great experience. I loved every little bit of it. I worked my butt off. We did some great things for patients. But after about that 2.5-year time period, 2-year time period, I was just kind of feeling unfulfilled in some way, shape, or form. I didn't know what that meant, but I wanted to explore it, right? So, an interview opportunity came up, and I talked to my boss about it, and, she encouraged me to just go ahead, and there's nothing wrong with it, of course. And so I did, and, after that, probably within 30 minutes of that interview, similar job, larger scale, different institution, but I knew that I didn't want to do it, and I didn't know why. And so I noodled on it a little bit and woke up the next day actually and said, I don't want to do anything like this at all. I want to do something on my own. I want to do something entrepreneurial. So I went through, a few ideas in my head and just started really sorting them out to see if they were viable or not. Could I support myself with the salary to make it legitimate, and is the idea worth pursuing as well? Could I make it viable? And went through a couple things, and then I just started looking up how to start technology companies, and it was as simple as the iTunes University had this free lecture course from Stanford that showed how folks start with an idea and take it, validate the business, maybe raise some money, and get a product up and running. And what I realized from those videos is that these people aren't any different than you or I. They're passionate people, they're talented, and they're willing to work really hard. And I felt like the idea that I had in my head for DocStation fit right into that, and it really gave me the confidence to go out and do it. Now, looking back on that time, I really knew nothing for what it takes to get a business off the ground, but it's just about making that commitment and knowing in your heart the right thing to do. And once you do, you just figure out along the way.
Yeah. Awesome. So lightning strikes and you make the plunge, right? How long have you guys been operational now?
Yeah, so we've been, it's been about 18 months since I left my job. And for the longest time, the hardest part was finding the right partner to work with, right? I don't have any friends that were computer science majors or anybody I grew up with. So I had to, I arrived in Austin and just got looking and started networking and talking to people, and finally found our co-founder, Josh Matz. And we've been working together for the past almost a year now. So, started with some prototyping and designing, and then actually got a prototype developed. And that's when everything kind of changed. We had something real to go out and show people and market. And so now we're in the stage of things where, we're really focused on the product, making sure that it's great and it's going to be different than anything anyone has ever seen. And cultivating the interest in developing the business side of things, so we can have funding to keep it going.
Yeah. So how do you guys work together? You mentioned co-founder, Josh. How do you guys work together? What are your roles?
Yeah, so I serve as CEO. I'm pretty much in charge of designing the product as the subject matter expert, as a pharmacist, and having the tech experience in the healthcare industry as well. It's really important to know how the healthcare system functions, how payment is transacted, who's incentivized by what to make a product work, I believe. So, that's my main role, and then developing the business as well. And so Josh comes in with all of the technical experience that, complements, mine. So, I can talk about what we're looking for or mock something up on a whiteboard, and he'll come in and say, okay, yeah, we can do that, or we can't do that, or this is hard because of X, Y, Z. And we just work together to create a plan. And it's really great because Josh doesn't have any experience in the healthcare industry. He's not, has all these, predefined notions about how things should work. And so bringing that outside expertise and having him as a real great designer as well, just, it's a special kind of a relationship and working environment. And so it's really neat. And
sounds like it complements perfectly. I mean, if you're looking at where DocStation is today, where would you say it is today if you were to assess it, and where would you like to go?
Yeah, exactly. So right now we have the prototype developed. We actually have about 70 users on the platform. And the point of this is to do some user testing. So it's all test patients. Nothing's quite functional yet, but people can go in, log in, access test patient profiles, play around with it so they know that the information being collected, the way things are organized, the way it looks and feels is appropriate. So it's all about, that iterative process, that kind of lean methodology, design, test, and then implement. And so having that serve as validation up front makes us very confident that we're going to put out a great product. And so now we're in the stage where we're developing the larger interest. So looking at payers, looking at major pharmacy chains, looking at pharma, anyone who's interested in the data related to healthcare, and driving up quality and driving down costs, something that we know pharmacists can do and they can do very well. We just have to give them an opportunity to do so, and we're hoping to do that through our platform.
Yeah, perfect. What advice would you give to people who are looking to follow a similar path, maybe make the plunge themselves, do something entrepreneurial? What advice would you give people looking to do something like that?
Yeah, great question. I think the number one thing is to kind of look inside yourself and figure out what it is that you truly want to do. What is the impact of the mark you want to leave on pharmacy, inside pharmacy or outside pharmacy? And it doesn't have to be anything specific. It can be even general to start with. And just let that idea kind of sit in your head and keep thinking about it. And if something comes out that you decide that I want to do something different than what I'm doing currently, figure out what your very next step is and how to progress that. It doesn't mean quitting your job. It doesn't mean tossing everything aside. It means just do one thing to move the needle a little bit forward. And eventually you start taking steps and making progress, and you learn whether it's something that you really truly want to do. And so I think a lot of people, especially pharmacists, we can be pretty conservative sometimes and scared, and it's okay to be scared. But once you realize that, you really can do anything, you just got to take it one step at a time. I think you got to give yourself permission to do that. And so that's my number one piece of advice is don't be scared. Do something that makes you uncomfortable. It's fun.
I love that. And one step at a time, if you do that over enough amount of time, you add that up, and actually now you probably accomplished something pretty cool, right?
Yeah, exactly. That's what we're trying to do.
Right. So last question I want to ask about, I want to get your take because you've done something different. You've made the leap. Where do you see the field of pharmacy going in the future, just in general? You know, where it is today, where do you see it going in the next few years?
Yeah, I see. I wrote a little bit about this in our blog, but I really think that pharmacists are an incredibly underused resource. The amount of knowledge and skills and talents that we have, to have a majority of our profession be employed to dispense prescriptions it's unacceptable, and it's something that we have the ability to change. So what I really see is this, a lot of the legislation right now, it's on the federal level, is about increasing access to patient care. And who better to do that than pharmacists? Where our locations are ubiquitous, we have the skills and talents. We can replace dispensing with technicians and automation. Let's put ourselves in front of the patient. So I really think that we could be what most people see as a mid-level provider today, and really be a dominating force in patient care, on the primary care level in particular. What it's going to be about is the data. So if we have the data to show that we provide a high level of care to patients, we drive the cost of care down, the payers will come to us. And we just have to cultivate that infrastructure and making sure that we're doing a good job. And we want to provide the tools so the pharmacists can focus on the patients and make all that happen. So I really think that, we're going to be in front of the patient more. We're going to be trusted providers and not dispensers.
Yeah, it's headed in the right direction. And Sam, you're a big part of that direction and helping the profession get there. Where do people go to learn more, connect with you, learn more about DocStation?
Yeah, absolutely. The first place to start is our website. So DocStation.co. On the website, you'll find information about the platform. You can also follow us on Twitter and Facebook and all the social media outlets, LinkedIn. And we have a newsletter as well. So just go to any one of those resources. You should be able to find that, and just keep in touch with us. The platform's going to be ready by the end of 2017, and plan on pushing out to as many people as possible. And you can always reach out to me, Samm@DocStation.co, and I'd be happy to have a conversation with you guys.
Great. Thanks, Sam. Thanks for your time today. We really appreciate it. I encourage everyone listening to connect with Sam via Twitter, via Facebook, at his website, DocStation.co. I'll post all of that below this post. Thanks for tuning in today, everyone, and we'll see you next time on TNP. Take care.